What is AlloClae, and how does it differ from a traditional filler like Juvederm?
AlloClae is a new product that's on the market. It's a structural fat product that's derived from human tissue. So it's an off-the-shelf product that comes in a syringe, and one of the advantages is it has higher volumes than some of the other previous products that have been out there. And it is a human-derived product, so it's more natural than, say, a product like Juvederm, where it's more of a protein that's synthesized in the lab. So there are some advantages to it in terms of the body accepting it. The advantage of it is you don't have to harvest fat. Like traditional fat grafting, which is still a tremendously powerful procedure, harvesting fat with liposuction from the individual patient. In some cases, patients don't have a lot of their own fat for donor tissue. And so this is tremendously helpful, and you can take this off the shelf, inject it, and also you don't have the downtime associated with donor site surgery. And so it can be done in the office with just local anesthesia typically.
What is the no lipo advantage of AlloClae?
The benefit of AlloClae is you don't have to harvest fat using liposuction. The patients that are athletic or that really don't want to go through the recovery for liposuction or don't have a lot of their own natural fat, or that if we took that natural fat, it would leave them with a secondary deformity. Their fat, they don't have excessive fat, I should say. So it can be, it's really a great option in those cases, especially for patients who want a little bit more, a little bit easier recovery, potentially don't want the downtime associated with a liposuction harvest of the tissue.
How are you using AlloClae to smooth edges and create a more seamless look?
Whether it's fat grafting or the use of AlloClae, fat grafting can be a tool to help address some rippling. So depending on where implants are placed, sometimes you can see some visible edges or wrinkles in the implants. Using fat grafting can help add a little tissue to smooth those areas out, and it's just really kind of softening the edges. So the advantage of the AlloClae is that you don't have to harvest it with liposuction. It's off the shelf. There's a little bit more recovery, but it's just another tool to be able to do that with a little less downtime.
Can AlloClae be used during the primary breast augmentation, or is it strictly a secondary touch-up tool?
AlloClae can be used as both. I think it's an alternative to traditional autologous fat grafting. It can be used in a hybrid breast augmentation, especially in patients who don't have a lot of fat for a donor site or have had liposuction before. The primary breast augmentation can be performed with the implant, and AlloClae can be used in lieu of fat grafting to add fullness to the upper part of the breast or to the medial breast.
How long can a patient expect their results to last using AlloClae compared to synthetic fillers?
Synthetic fillers, often those results will go away. All these proteins that are lab-derived for the most part are absorbed within about a year. Now, occasionally they can impart or create some collagen formation, but it's not going to be as durable as autologous fat or AlloClae. So the advantage of adipose-derived tissue or fat graft material itself, fat grafting, is that this tissue is going to be more durable, going to have a higher longevity, particularly indefinitely. However, the weak point of any fat graft material, or whether it's autologous fat or AlloClae, is the retention rate. So we talk about retention. And I typically quote patients about 50% fat retention. It can be upwards of 70%. It just depends. I think you get more retention in the face than you do in the body. Whereas with fillers that are coming out of the lab, you pretty much get that 100% of that retention over about the year. But then what happens is it gets absorbed by the body. So at least for the fat, after about 3 months, that's when I know that I'm going to get that retention permanently to some degree. And the interesting thing about natural fat, especially if it's a patient's own natural fat, is that fat can respond to changes in weight, whether it's weight gain or weight loss, because that fat will behave as where the fat, like it did where it came from. So if it's abdominal fat and a patient has a little weight gain, that fat will hypertrophy and get a little bit bigger, and we'll see that fat increase.
Is AlloClae safe?
AlloClae is safe. It's been shown by the FDA to be a safe product. I think the biggest concern with either fat grafting or use of AlloClae is it can cause some calcifications or cysts, fat cysts, after the placement of the fat. And this can be something in some patients that can be little lumps or even be visible. So it's a low risk of complication, but it can happen. And I think we've seen that, and I've seen that with fat grafting over the years. So the techniques I use to harvest the fat, use small cannulas. The technique for how it's injected helps to minimize that, but that is a risk.
How long does AlloClae last?
The retention rate for AlloClae is probably somewhere between 50 and 70%. I think that number is still being studied to see what that exact retention number will be. And retention has to do with how much of that tissue survives in terms of its durable volume over time. After, again, about 3 months is typically when I'm going to see that volume retention stay. And I think if you can get that retention volume after about 3 months, you're going to have that long term.